2, 1. Blog Talk Radio.
Welcome to Medicaid Matters, the only live talk show about the business of Medicaid health care. And now, here's the host of Medicaid Matters, Richard Yaden.
And thank you, Braley. It is great to be with everyone today on this very special broadcast of Medicaid Matters. It's special because of where we are and what we're going to be talking about today. I'm Richard Yaden, President and CEO of Managed Medicaid Services, and your host for the next 2 hours of our special broadcast. We're broadcasting live from the U.S. Chamber of Commerce here in Washington, D.C., and we're here for the Medicaid Health Plans of America's Center for Best Practices second annual awards forum. And if you're unfamiliar with this event, then just stand by. I'm going to give you all you need to know about this and why you're going to want to be here next year. Over the course of the next 2 hours, we're going to be talking about the 6 different awards that have been and are being given out today. We're going to hear from some of the companies and their representatives that received those awards, and we'll be hearing from the Center for Best Practices Director, Michelle Martin, as well. So strap in, maybe get pencil and paper, because we're going to be going through a lot of information today about what's going on in Medicaid and the best practices associated with managed Medicaid health care. The next 2 hours are going to be packed with insight, packed with information about some of the best in Medicaid today. Now, our regular listeners and our regular viewers know that Medicaid Matters brings you the most up-to-date information that's practical, relevant, that's on the cutting edge of Medicaid health care. We have information, we have guests, and not only does the quality of the content of this show set us apart, but also your involvement as a listener or as a viewer is what makes this show truly unique. We are interactive, and we're ready to hear your comments, take your questions and your opinions about our topic today. The easiest way to do this is just to give us a call, 626-657-2125, and we'll take your calls throughout the show, and you can join me here on the air with your questions and comments over the next 2 hours. If you can't call but you want to have some input, you can tweet us at Medicaid Talk, and we're ready to read those back on the air as our program schedule permits. So here we are. As you can tell, we're in a much different venue than what our normal show is. And if you're not able to, or if you didn't know you could watch the show, you could go to MedicaidTalk.com. We're live on the air via Ustream TV, and you can watch the show and meet our guests that way as well. So what is this awards forum all about? I'm sure that many of you are familiar with Medicaid Health Plans of America and the great work that they do. Well, several years ago, they created the Center for Best Practices. Now, the MHPA Center for Best Practices is an initiative that Medicaid Health Plans put together. It's an initiative that they created to compile, to develop, to promote best practices in the clinical and operation areas of Medicaid health plans. The center compiles and develops and promotes those best practices. Specifically, they conduct data-driven research that addresses various needs that many Medicaid health plans have. Number one, it addresses operations, including conducting research on issues of operational value to MHPA members and the Medicare health plan community in general. Number two, it supports MHPA's advocacy agenda of clinical and operations research. And number three, the dissemination of best practices and key research findings about Medicaid health plans and their members in the healthcare community, and that's why we're here today. We're going to be awarding those best practices, or I should say the Center for Best Practices is going to be awarding those best practices, and we're going to have a chance to talk with those companies and those representatives that have done that. Now, if you're unfamiliar with the Center for Best Practices, really it was created to become the preeminent repository of information about the health of the medically underserved. For many years, they have compiled a best practices compendium. This is an example of what this year's looked like, and we're going to be referring to it quite a bit throughout the show, as it has every one of the best practices that were nominated for an award today in this compendium. One of the most valuable resources, I can tell you from personal experience, is the information that's in this publication. Later in our show, we're going to hear from the Center's director, Michelle Martin, and she's going to be talking to us about not just this awards function here, but she's also going to be talking to us about some of the things that is going on in Medicaid health care. Now, last year, the Center hosted the first annual awards forum, and it was a great success. It has grown in size this year as far as participation. Companies that were honored last year really was a list of who's who in Medicaid health care. This year, over 12 different companies are being considered for awards across 6 best practice categories. In all, 66 best practices have been nominated for one of the 6 awards. And throughout today, each of the 6 awards will be presented, and in between each of those award presentations, there will be speakers that are presenting on a variety of Medicaid hot topics. During the next 2 hours, we're going to be talking with many of the award winners and their accomplishments, and perhaps some of the speakers as well, if we can work it in. So a lot of information to go through over the next couple of hours. The awards today, if you haven't had a chance to read up on them, the awards today really encompass a wide spectrum of the areas that Medicaid health plans work in, areas where innovation and creativity are needed, and are being developed to deliver the care to the Medicaid population. And I think we can all agree that it is becoming increasingly challenging to do that job in this environment, whether it's the economy, whether it's state budgets, health policy, or health issue changes. These award winners have found a way to break through and succeed. So there are 6 separate award categories that are going to be presented today. One is the Make a Difference Award, and this is given to the best practice that has the biggest impact on the lives of the Medicaid health plan enrollees. Another award is the Technology Award. This award goes to the best practice with exemplary use of technology, and in fact, there were 2 award recipients in that category. That one has already been given away this morning. The Outreach Award honors the best practice of outreach that affected the lives of Medicaid enrollees. The 4th award is the Cultural Competency Award, and this is an award that's given to the best practice that exemplifies Medicaid health plans' dedication to working effectively across different cultures. The Children's Health Award is presented to the best practice that represents a Medicaid health plan dedicated to the quality of children's health. And then finally, the Innovation Award. And this award is conferred upon the Medicaid health plan with the overall best practice in the industry for 2011 and 2012. So, as you can see, almost every spectrum of areas that Medicaid health plans are involved with are being recognized in this Best Practice Award ceremony. Well, joining me now, as you may have noticed sitting next to me, is Dr. Lovelace, and he is the first award recipient this morning. So welcome to the Medicaid Matters show.
Oh, thanks. I'm happy to be here, and I'm not a doctor.
You're not? I thought you were. I'm sorry. Well, you just got a promotion. Well, John is part of UMPC, but a special part of UMPC was recognized today, correct?
It's actually UPMC.
UPMC, I'm sorry, UMPC.
Yes, UPMC is a large global health enterprise, a large healthcare system, part of which is an insurance division. I work in the insurance division in the public program section in Medicaid particularly.
Okay, great. And you won the Make a Difference Award.
It's very exciting.
Yes, it is.
We're able to, this is actually a product of a Robert Wood Johnson local funding partnership grant, which has largely come to an end. We have 1 more year to run on this project. It's really an interesting blend of early intervention programs with depression screening and treatment, which doesn't really happen most places. These are programs that operate in different kinds of silos.
Right.
So it's a great opportunity to sort of put some logical things together.
Now, the award was Helping Families Raise Healthy Children.
Exactly.
Yep.
This is really a screening and referral intervention focused on parents of kids with developmental disabilities or delays and their children. So it's sort of a cross-system effort in which the caregiving parents, or almost all moms in this case, with kids who have been identified as having delays or disabilities, are screened for depression. They've, as you might imagine, quite a high rate of depression, and very effectively linked into treatment. It's a pretty well-known fact that depression interferes with any parent's ability to do many things, including raising healthy children.
Right.
And the stressors of a kid who has delays or disabilities make it even harder for folks, trying to organize services, trying to keep the family together. And then also we are screening the children of parents who identify with depression, preschool kids, for developmental delays. And there's a fairly, not a huge rate, but tracking the effect of depression on a child's well-being is another exciting part of this project.
Right, I would imagine so. How many people, or how large of a population was impacted by this program?
It's about 2,500 people over the course of the couple of years of this grant. They're about 4,000 or 5,000 Medicaid babies delivered every year in Allegheny County, where Pittsburgh is, which is where this project is focused. So of that group of people, over that's about a quarter to a third of the people are actually screened, either have one of two criteria and are screened.
Is it a program? I know it's part of a grant, so we kind of use that to get the thing started. Is it something that you see that will be somehow incorporated in overall operations?
Well, we've actually have moved forward a bit into our own operations. We're going to move into other parts of the state. We've been meeting in a couple of weeks with the Deputy Secretary of the Office of Child Development and Early Learning, who's interested in helping us on the statewide level to roll this out. It's not actually a very expensive intervention.
Oh, good.
Once it's up and the staffing and the grant reporting takes some effort, and the training training of the staff. But once staff is trained, that's where most of the money goes. So the actual screening itself is not very expensive.
Well, that's great.
So we hope to continue it ourselves, and also to see it spread to other parts of the state and other parts of the country, for that matter.
Tell us a little bit about the results, and if you can quantify it in terms of if you can, clinical results, and then maybe cost savings in that standpoint.
Cost savings are kind of tough, because the savings, I think, are really in the long-term well-being of the kid, and this is really in year 3.
Okay.
What we expect to see in the savings are the children who are more effectively intervened with when they're young being between 0 and 3 or 4. This is pretty clear, actually, generally, use less special education. They may use the same healthcare. This is really, the savings are more on the education side, probably, in special education, than they are on the healthcare side, although screening does still prevent some health complications as well. The rate at which, one of the kind of exciting parts about this is particularly, but not only in the Medicaid population, many people are screened positive for depression but don't actually go to treatment. And this project has just done a wonderful job of getting about I think, 70% of the women who screen positive, and men, actually get connected to treatment for the depression, whether it's medication or therapy or some combination. And that's remarkably higher than it is normally.
Yeah, I would imagine so. So it sounds like that since it's only been 3 years, you're dealing with young children, the real health and cost benefits are going to be kind of measured over the lifetime of those children. I think
that's right. At least probably through age 10 or 12. These kids get started in school, the idea is they will, because they don't need extra supports, will not fall behind in school, will do better, will achieve more successfully, and their parents will have, and the rest of the kids in the family will benefit as well, because depression affects everybody, not just the kid who's identified.
Right. Did you learn anything in the course of this that you were surprised to find?
Interesting question. There are always new things to learn. There are things you wouldn't have thought of. One really is how, I think, the screening is done by early intervention providers, not by behavioral health people. It's kind of remarkably surprising, I think, how effective early childhood people. These are folks who go to your house and sit down with you and your kid and go through some linkage around referrals and services. And they can continue to relate with you over time. So it's really, I think, the surprising part in a way is the level to which the relationship the early intervention people have with a family really impacts the ability to screen and get people in treatment. And I think that is, if we're going to pick one factor that accounts for the treatment successes, it's the relationship that gets women and men actually to call and follow through and actually get the service.
And we're hearing that from a lot of our clients, that how trying to build that relationship and having it a consistent relationship is having an impact on compliance with care management programs and things like that. So it's kind of along the lines of what you're talking about. And I think that with a program such as this, when you're getting kids involved in being healthy early, that is going to have a long-term impact.
Absolutely. Not only kids' physical health, but also on their psychological health.
Yes. Yeah.
We think this is going to be a demonstration of usually for lots of people, the early intervention screening is much less stigmatizing than behavioral health screening is.
Yes.
So people are much more willing to accept things that are for their kids than for themselves. And like many parents. I can wait, my kid has to go first. So this is a way of sort of hooking people differently.
Right. So what's next with this program?
The next, well, we have one more year on the actually there's a roll we did not spend all the money. So we have another year in terms of the roll of this project. Our big efforts this next year are looking for sustainability measures, whether it's with the state Department of Public Welfare, who's kind of responsible for all of these parts, and in demonstrating the financial cost benefit of this. So I think it's an easy sell conceptually, but everything is, especially now, is a tough financial sell.
There's no question.
We've been approached by people from other parts of the state who said, we'd like to do this. We're going to do it on our own money. So I think we'll find this to be sustainable.
So you feel like you've built a model that could be replicated across other populations?
I think, I certainly haven't, but the people who do this project have. We have a wonderful grant staff of one, but a whole lot of very effective partners, and that's really the really exciting part of this. The behavioral health partners have been really, really well engaged in this process. The early intervention provider, it's called the Alliance for Infants and Toddlers in Allegheny County, has just been a wonderful partner. The leadership of these organizations have been very, very supportive, as has the County Office of Behavioral Health leadership.
Right.
We have a great set of partners.
Now, UPMC has been nominated for several awards today.
We have a wonderful staff of people, as do our colleagues, of course, in Medicaid, who really try to push the edge on innovations in Medicaid and trying to do more than come every day and make sure the clock keeps running. So we have a really great team of innovative thinkers, I think, in terms of analytics, in terms of behavioral health, in terms of really pushing the edge on some new ways of thinking about care.
Well, given the environment that you have to operate in Medicaid today, innovation and creativity are the name of the game.
Absolutely. It's a great place to be, actually. It's always been a lot of fun. It's very rewarding to see these. Not everything works, of course, but that's the point of experimenting.
Right.
Just find things, well, that was a silly idea.
Yeah.
I've had a few of those.
Yeah. I think we all have.
Let's not do that again.
Yeah.
But there's some things but you learn, even from bad, things that don't work out so well, you learn some good things.
Yes.
And some of the projects we're up for today, I think, are things that we've been particularly happy with.
Yeah, I could imagine so. Is this the first awards forum that you've been to?
No, this is the second.
You were here last year as well.
I'm actually the chairman of this event.
I didn't realize that. Boy, so much for being a great host here. I didn't realize that.
The Center for Best Practices is a nonprofit.
Yes.
I'm one of the officers of the corporation, and I'm the program committee chairman of MHPA. So by the dint of that, I get to be the chairman of this event. So
you're as involved with MHPA as you are your own organization.
It's a very, yes. We
But
spend
very
a lot of time
rewarding.
with MHPA. It is. And this is our second event. We had a nice bigger turnout this year than last year.
Yeah.
Gets a little buzz on this.
Yeah.
So now we have people from the media. This is very exciting. Regular rock star kind of people here. We have a nice turnout. It really generates some interest in this. A lot of working in Medicaid is, of course, it is a business.
Yeah, it is.
If you were in the room this morning, you heard Joel Menges perhaps talk about the opportunities around what a poor job fee-for-service does in managing everybody. It's not just Medicaid.
Right.
It's left to you, the patient, to figure out what to do.
Yeah.
And managed care in its good moments.
Right.
Creates some opportunities around quality improvements and some focus. And really to innovate.
Yeah.
It's an exciting place to be.
People outside the Medicaid community, I think they lose sight of the fact that Medicaid health plans are at risk, and they are, on the forefront of delivering this care in a very difficult environment. And when you factor in the budget aspect of it, state regulations, because we have clients that work in multiple states, and it's almost, well, the old saying, I hear this on my show all the time, if you know Medicaid in one state, then you know Medicaid in one state.
That's right.
And it's very difficult.
It's a great challenge, and Medicaid is an ever-increasing expense.
Yeah.
Is the economy, just not really recovered very well? It creates more people who are eligible for Medicaid. We expect another huge expansion in 2014, depending on what the Supreme Court decides we're going to do. That adds millions of more people to Medicaid rolls, and Medicaid is much more complicated, I think, than commercial health insurance is. There's much more oversight, many more rules, many more opportunities.
Yes.
and it touches so many people.
Mhm.
It's a great opportunity to really move forward, I think, and be sort of on the leading edge,
Right.
or the bleeding edge, as we call it.
Yeah, the bleeding edge. That's right. Well, you mentioned the Supreme Court in Medicaid, and I know it's a very hot topic right now. We did a show, I guess it was 2 weeks ago, on the Supreme Court and the future of Medicaid, and I had some people, policy experts in the industry, talk about what would happen if they do decide Medicaid expansion, as in the Affordable Care Act, is unconstitutional and it gets struck down. What do you think would happen with your organization if that does happen?
Well, in one sense, I don't think anything will happen if you just won't expand.
Right.
The expansion creates new opportunities to improve healthcare, and the bigger swath you have, the more impact you can make. But if this is unconstitutional in some fashion, then we'll be where we are today. There's still millions and millions of people in Medicaid.
Yes.
And great opportunities to improve. Medicaid has, as you know, a lot of, particularly the non-disabled popular part of Medicaid, very rapid turnover of people. The average non-disabled person in our plan is around for about 8 or 9 months. So your opportunities are very short-lived in terms of what you can do with the people. Your opportunities in terms of how you can help change the system, however, are much different, because it drives a lot of how people operate. Right.
Do you have a large percentage of eligible people in your community that are not enrolled?
I don't think so. It's hard to know. There are always some people who are eligible who aren't enrolled. Some people lose eligibility because a paper gets lost. So they really are eligible, and they have gaps in care because they're gone. We about 10 or 12,000 people a year, I think, go through our plan, and they're off eligibility for a couple of months, and they're back. And I think that probably indicates a paper processing problem more than your income suddenly shot up and shot back down again.
Right.
There's a stigma to Medicaid for some people. There are people eligible who don't do it because there's some it's against their religious beliefs or against their personal beliefs, or something they think they shouldn't, just isn't right for them. Pennsylvania's done a nice job over the years, I think, of trying to reach out to engage people, but we do both Medicaid and children's health insurance, and in both cases there are certainly eligible people who aren't aware or have chosen not to enroll.
The reason I bring up is one of the people I had on the show was talking about there's, even if the Supreme Court says that, and I know this is way off the subject that we were going to talk about, but it's interesting. I said even if the Supreme Court does say Medicaid expansion is unconstitutional, there are billions of dollars of expansion already built into Medicaid just from the people that are eligible but aren't currently enrolled.
There are, and if you heard this morning, but one of the other really big opportunities in the next couple of years is around people who have Medicaid and Medicare.
Yes.
The people who have
the dual eligibles.
Who, of course, don't call themselves dual eligibles.
Right.
It's just our
that's our insider term.
That's right. Who are a relatively small group of people who consume a great deal of health resource, and as Joel Nenji said this morning, are people who are crashing and burning all the time. They can't find their way through the health system very successfully. Lots and lots of acute interventions on what are really chronic problems.
So what's on the drawing board for UPMC now that might be nominated as an award next year?
We have a new Robert Wood Johnson grant, actually starting in May, which I'm very excited about. It's a payment reform grant, and it's focused on medically complicated Medicaid children. So kids who have disabilities or kids who have chronic diseases. It's really an effort to get a handle around improving the organization of care and the outcome of care, and it also is looking to engage some families in more control of the care they get. Lots of kids in Medicaid have long-term supports, private duty nurses or other home health supports, and lots of money spent kind of organizing that. And part of this is to engage families differently around planning, and part of it is to work with pediatricians, particularly pediatric health specialists around planning. Lots of opportunity to better coordinate
No
things.
question.
It's a partnership with the Children's Hospital in Pittsburgh, their community pediatric practices, and a whole bunch of other stakeholders. So that's a pretty exciting event.
Yeah, I could imagine. Well, thanks for taking a few minutes to join. I know you're very busy today, being the chairman of this and award recipient.
No, actually, the staff's doing all the work. I just get to smile and look pretty.
That's right. I wish you had brought your award. We could have had it on display here for everybody to see. But thanks for coming by and spending some time with us.
Thanks. Nice to talk to you.
Yeah, my pleasure. It's John Lovelace. He is chairman of the event, the awards event here today, and also UPMC, a recipient of the Make a Difference Award. So thanks, John.
Thank you.
Appreciate it. Well, each throughout the next hour and a half or so on the show, we're going to have different people that are the different award recipients who have been nominated and presented with an award here are going to be a part of our show, and they're going to be on with us as we go throughout the day. We talked about the different awards that are actually being recognized today, and these are the kinds of things that the Center for Best Practice is about. If you've not visited their resources at MHPA.org, then you should make a point of going there sometime this week. I think you will be pretty impressed with what they have going on. The program here actually started a few hours ago, early this morning. We've already seen the best practices of 3 of the 6 awards honored, the Make a Difference Award, the Technology Award, and the Outreach Award. We just had a chance to talk with John Lovelace about the Make a Difference Award. And in just a few moments, we're going to have the recipients of the Technology Award that are going to join us. Now, this is an award that has been actually conferred upon 2 different organizations here. And as you can imagine, technology and the innovations in technology play a very important role in moving Medicaid forward. And having them here with us is a real treat and an honor to be able to do that. How are we doing?
Great.
Good. Let me get my information here organized. We're about ready to go to a break, though, aren't we, Charlotte, in just a few minutes? You want to go ahead and do that now? And then, all right, we're going to take a short break for just a couple of minutes. We're here at the bottom of our first hour. When we're going to come back, we're going to be more live from the U.S. Chamber of Commerce in just a few minutes, so stay with us.
The solution is managed Medicaid services. Through our virtual case manager network, our teams of Medicaid assessment specialists, and our new advanced care transitions program, companies can dramatically raise the quality of care without increasing their costs. Visit us today at MedicaidServices.net. Managed Medicaid Services, your best source for innovative care management.
The Medicaid landscape is changing fast, and that means challenges. But it also means opportunity. Opportunity for you. And that's why you need to visit MedicaidJobs.net. MedicaidJobs.net, the place to showcase your talent to Medicaid companies, search for jobs, research the latest career trends, and register for the free Career Optimizer service. Don't wait. Go to MedicaidJobs.net today.
I'm trying to find it. I can't hardly hear anything.
Do you know how far back it was?
We're going to talk about it. And welcome back to Medicaid Matters. This is the only live and interactive show about the business of Medicaid health care. You know, MedicaidJobs.net is becoming the place where the Medicaid community goes to post their jobs, to research new opportunities, and to accelerate the next step in their career. Our firm, Managed Medicaid Services, is currently working on hundreds of jobs for Medicaid and Medicare organizations. Many of them can be found at MedicaidJobs.net. If you don't see what you're looking for, then give us a call at 866-371-0687, extension 210. Well, we're going to continue our conversations here with the award-winning recipients at the second annual Medicaid Health Plans of America Centers for Best Practices second annual awards forum. And with me right now is Don Graff and Rita Johnson-Mills of United Healthcare. How are you doing?
We are wonderful.
You might need to move just a little closer to the microphone if you can. I know we're kind of cramped in here. But you are one of, well, you're actually co-recipients of the Technology Award this morning. Did you happen to bring it with you by any chance?
Yeah, I forgot another.
All right, well, we'll get it. We don't want you to have to leave to go do that. Now, tell us a little bit about the program that you won this award for.
I'll ask Don, since he's one of the primary developers of it, to take that question.
Well, essentially, we're using telemedicine technology and coordinating the delivery of services to complex pediatric children living on the Navajo Nation. Most of these children are neurological in the diagnosis that they have, and often have to travel several hundred miles each way in order to see a physician. This helps them and their families being able to receive services in their community without having to travel those long distances.
I can imagine. How many people are involved, or how many children were involved in the program?
Right now, today, across the state of Arizona, there's 24,000 enrolled members covered by United Healthcare that meet these complex diagnoses. On the Navajo Nation, the numbers are quite a bit smaller, but they are extremely remote people, and why we targeted that smaller population to receive these benefits. Hopefully, with the success of this program, we'll be able to reach out to other communities and expand the services using this technology.
Well, I can certainly attest to how difficult that group is to reach. Our firm a couple of years ago put together an assessment team for a Medicaid health plan in New Mexico, and the Navajo Nation there was part of that. And the only requirements we had was a nurse who could speak Navajo and have a four-wheel drive pickup truck. And I remember seeing some of the directions on how to reach some of the members were, there were no streets names or anything like that. It was mostly landmark driven. So it's a very difficult group to reach.
Yes, and we're actually using this project across United Healthcare community and state. We're currently located in 23 states plus the District of Columbia, and we're the largest Medicaid health plan in the country, serving over 3.6 million lives.
Yes.
So our goal is to learn about the cultural needs and differences of different populations, and we're learning a lot from the Navajo Nation's project so that we can continue to expand these programs in other states that we're in, where we're primarily dealing with rural populations that are not used to accessing the U.S. healthcare system. So very exciting.
Yeah, it is. And it's something I was going to ask you about is this a model that can be exported to other locations? It sounds like it is.
It is, and Don can speak to how it's being used even across the state of Arizona. We also have a health plan in New Mexico, so we're watching this very closely to see what pieces of it can be adapted across that state as well.
I could imagine, yeah. Tell us a little bit about the actual mechanics of the program. How does it, how does a child get engaged in the program, and what does it do with them?
Well, first, the child has to have the diagnosis that allows them that level of complexity.
What would be an example of that type?
Spina bifida is an example. Cleft lip and palate is another example. Different neurological and cardiovascular anomalies are typical birth-related and ones that are complex enough to allow them admission into the program.
So we're not talking about just chronic things?
No.
Okay, all right.
Many of these require initial surgical interventions and then a lot of monitoring and so to a certain degree therapies over the course of the child's life. And in many cases, the every 6-month follow-up with a physician and or yearly follow-up with a physician until the child gets older is also part of the medical management of that child throughout their life.
Yeah, I could imagine. So they engage, I know this is a technology-oriented best practice, so how do they engage with the technology? Because to me, with someone being so rural and so forth, you think, well, do they even have cable?
Well, it's very challenging, as a matter of fact, and you almost have to go community by community. We targeted Tuba City. It's a community in the western side of the Navajo Nation. They fortunately have some T1 lines that go in to that location. We're engaging in discussions with other more remote communities, and to the extent that they either have cloud-based or internet-based connections, or some cases broadband. And unfortunately, in many cases, none of the above, in which case it makes the connections a little bit more difficult.
Do you see yourself bringing the technology into their area so that they can make those connections?
We're supportive of virtually every different aspect of reaching out to the communities, including the use of the cloud-based technologies, which seem to be the ones getting the most traction these days because they involve a lot less cost and capital infrastructure to make those to make that happen.
Yeah.
You're not having to lay lines and things like that.
And just to add to that, through the services side of United Health Group, Optum Health, we do have access to telemedicine vans where we take them into rural areas and actually have members and others actually connecting with physicians right through that telemedicine van. I remember my first experience with telemedicine where I was dealing with an ophthalmologist, and it was just so exciting to sit there and he's using a machine and he's in another state looking into my eyes.
Yeah, isn't that something?
That was just fascinating.
Yeah, we always thought that we'd be living like the Jetsons when that stuff happened, didn't we? But it's here. I mean, it's here, and it's real, and it's making a difference in the lives of people.
Yeah.
What have been some of the outcomes that you have seen from this program?
Well, we've conduct surveys with families and physicians for every one of the encounters that we do across the state, not just on the Navajo Nation, and we get a overwhelmingly high response, positive response of satisfaction from the families. The costs associated with and savings associated with these encounters are pretty self-evident when one considers lost wages, the mileage, and of course with the price of gas as it is, hundreds of thousands of dollars a year in savings for families, and in some cases even physicians who oftentimes will commute and travel out to those communities. They could be in their offices otherwise seeing patients during the time that they'd be spending on the roads. So high satisfaction, the cost is lowering. This is going to be a healthcare delivery model that we'll be seeing a lot more of in the future.
Yeah.
And just to add, I think two other things that we're seeing is it's just the building of the relationships and really becoming much more closer to populations that have primarily been closed to allowing healthcare companies in. And so we've been able to demonstrate a level of compassion that has caused them to open their doors and their homes to allow us to come in, because they truly can see that we value them and that we really want to be a part of making the healthcare system work for them.
Did you see any initial resistance to people to get involved with this when you first rolled it out?
The relationship, and I want to echo what Rita was saying, the developing good relationships with folks on the Navajo Nation really involved primarily trust and a long and sort of nurturing process by which, through that trust, we're able to extend and collaborate services to the people in their community. Not a small feat, and something that it requires a constant high touch and sensitivity, not only to the culture and the competency and how to respond to different cultural differences that and values that the Navajos believe and feel very strongly, and are things that we have to be very, very acutely aware of.
I would imagine. Yeah, and that brings up an interesting point. If if this is something you feel like you can export to other communities, how would this program have to change? Or I guess a better question is, how much is this program customized to the Navajo culture and community that it serves, and what would have to be changed to export it to, say, to another culture?
Well, from a technology standpoint, probably not a lot, but in the medical and clinical protocols that we have for how we engage with families and the patients will need to be adapted to the particular communities that we're involved with. How we treat folks in the Navajo Nation is slightly different than we work with Hispanic communities
Yes.
or with any others communities where different social needs and competencies need to exist. We're very acutely aware of those and respond to them accordingly.
Okay.
Yeah, United really does not approach healthcare as a one-size-fits-all. We try to take advantage of scale in those things where we can, such as technology and innovation. But when it comes down to what's going to work with a particular member population or our ethnic group, we really, really customize to meet their needs, to understand their culture, to make sure that it works for them.
Right. And we're seeing that in a lot of our clients where they're really reaching in and utilizing community-based resources to incorporate into the plan as opposed to trying to create everything on their side of the house and just make it fit within the community. Let me ask you a little bit about the technology side of this, because I know some of our listeners that are in that field might be curious about that. Was this a program that you developed from scratch, or was there something going on that you took and adapted and molded into this program?
Well, first of all, we selected the Tuba City location because they had expressed an interest in leveraging technology to service their community. And with that sort of spark of interest, we're able to collaborate with some state funding, some Title V block grant funding that allowed us the opportunity to enhance some of the equipment that they had to more of the high def and things that some of the neurologists really required in meeting this population, and so that helped, coupling that with the video conferencing capabilities offered by different companies, coupled with the T1 line connections, in association with the Arizona Telemedicine Program, which is kind of a network of T1 connections that we have in the state, all sort of brought together to as a package to fit the needs of the community.
Interesting. So what's the next step for the program?
Well, as we develop these relationships and offer this technology, we're already receiving inquiries from other locations on the Navajo Nation, and as you may be aware, the Navajo Nation crosses the state borders of New Mexico, Colorado, Utah. So without any state boundaries, getting inquiries from other communities on the nation to explore similar deliveries in their area.
Are they all communities served by United, or is it a mixture?
There are other health plans that serve the communities, but they're not serving them in the same way that we are. So we would focus primarily on those members that are served by United. So we have no boundaries where that is concerned.
Well, if anybody knows about scale, it's United. There's no question. Well, it's in the compendium.
Yes.
And organizations that have an interest in this can certainly see the outline of it if they want to, and it sounds like it's just a really, really interesting program. It's these things, I think, that's going to take us to move Medicaid to the next level, is a lot of creativity, a lot of innovation, and certainly the use of technology put into play, particularly in areas where, in the past, these people just would not have gotten any care just because you couldn't connect with them.
Yeah, and that's what I think is so important about this best practice forum, and what Thomas Johnson has been able to do through Medicaid Health Plans of America is really making everyone aware of all of the great things that's happening across all Medicaid plans, and what we can do to help move the healthcare industry forward for those less fortunate. So it's really an exciting time to be in Medicaid.
It is, and I think people that are outside of the Medicaid community or the state policy community, they really are lost on what people like yourselves are doing to, and the name of the game is we've got to help these people get the care they need. and to live better lives. And there are a lot of dedicated people, not just in this room, but across this country that are working on that.
Yeah, and as a former Medicaid recipient myself, I'm the product of the Medicaid program. I was born to a single female, one of 12 children, so I know what it's like to not have access to health care.
Yeah.
And to be in a position now to work for the largest health care company in the nation, making health care happen for those little people like me, it's pretty exciting.
It's no question about it. Well, it's great work. Well, I really appreciate you taking some time to stop by and talk with us. I know our listeners are very excited to hear about these types of innovations and developments, and congratulations on winning the Technology Award.
Thank you so
very
much.
much.
All right. Have a good day,
Thank
we'll see you around, I'm sure. Thanks.
Hopefully we'll be back.
That's right. For the next one, right? That's right. Well, that was Don Graff and Rita Johnson Mills from United Healthcare, co-recipients of, or United is co-recipients of the Technology Award for the innovation in their telemedicine program. And that's what we're hearing here at this awards forum. We're hearing a lot about new innovations. We're hearing a lot about the best practices of Medicaid health plans and what they're doing in the community. You know, and in just a moment, I think we're going to be joined by the other co-recipients, which is from Midwest Health Plans. Kathy Harkness will be here in just a few minutes to talk about the program that they won that award for, their best practices. We're trying to keep all this organized here because there's a lot going on today. So if we're moving through things rather quickly or trying to get our information together, just bear with us here, because I've never seen a greater collection of ideas and forward-thinking initiatives going on than is what is in this room today. So if you think that this is something you want to hear more about or be involved with, there's a couple of things that you could probably do. One, certainly go to MHPA.org, where you can access the past best practices compendiums. You can see what this event's about, but also see all of the nominees. For instance, in the Technology Award, while they picked 2 best practices, there were 6 total nominated to be a part of that award. So it's there's a lot of things going on in Medicaid, as both Rita and John were talking about earlier. There's a lot of things going on, and you need to be a part of that. And this is one of the events that you can come to and do that in. So we've already heard from the first award that was given out today, which was the award for overall effectiveness in Medicaid best practices. We've just talked with 2 of the recipients of the Technology Award. That first award, again, was the excuse me just a second here. We've got, as I said, we've got a lot going on. The Make a Difference Award, and we talked to John Lovelace about that. We just talked with folks from United Healthcare about the Technology Award, and in a few minutes we certainly have planned, but again, there's a lot going on here, to talk with the folks at the Midwest Health Plan, who also won an award for technology. Well, one of the things that's going on here, in addition to giving out awards, is a series of speakers that are talking about some of the hot topics that are going on in Medicaid. Earlier today, we had a presentation from Dr. Richard Gregg, who is Associate Professor of Environmental Science and Policy Chair at the Florida A&M University Environmental and Sustainability Council. He spoke about environmental health disparities, managed care dilemma, and opportunities. I think we're all aware that there's environmental impacts on health care, but he had a very interesting approach to this subject in talking about the health disparities between environmental health, or the environmental impacts of health care, and how that is impacting managed care, and how companies should approach the environmental aspect of the health of their populations, of their patient populations. And it's something I frankly had not given a whole lot of thought and discussion to. I mean, we all know that environmental health is going to have an impact, but how a health plan can actually take the information that has been developed and studied regarding the environmental impacts on healthcare and using that to plan and link in their care coordination efforts. That's something that I don't think we've heard a lot of discussion on, and I've heard a lot about. And Dr. Gregg talked about a systems approach to manage care in the context of sustainability science. Again, it was a very, very complex, very detailed presentation. There's no way I can probably go through every single piece of it in the space of time that we have here. But there were a couple of points that he brought out I thought were particularly interesting. First, he talked about the triple bottom line and how companies, and here we're talking about the business side of Medicaid healthcare, but talking about how companies should approach the triple bottom line and compare three separate bottom lines in their operation. There's, of course, comparing the triple the triple P&L or the traditional P&L, and then talking about the people account, the social responsibility that a company has, and then the environmental account. Sometimes this trio of bottom lines is called the profit, the planet, and people bottom line and approach. So in his presentation, he discussed how that triple bottom line really has to be taken into account for any company that is trying to undertake and understand the impact of environmental sustainability in their healthcare and their care coordination continuum. The role the environment plays in health disparities was another area that he talked about and discussed. For instance, disparity in health between minorities and whites is in part due to their exposure of environmental and social stress. Well, I think intuitively that's something we've heard for a long time and certainly have an awareness of it. But to hear his presentation dig down into exactly what that means in different disease states or what that means in different conditions was something that I don't think we hear a lot about. He also brought out the fact that low-income people, and again, this is speaking directly to a large part of the Medicaid population, low-income people are disproportionately located to sources of environmental hazards. And yes, intuitively you say that's something you may be aware of, but how do companies, how do Medicaid health plans, especially Medicaid managed care health plans, how do they take that and factor that into their operations and how they're going to move forward in the way they're going to care for their populations? And I for one don't hear a whole lot of conversation about that, but certainly it's something they have to look into. And some of the specific health issues that he addressed as a part of this were neurotoxic disorders, lung and respiratory disorders, kidney dysfunction, cancer, and so forth, and the very large linkage, the very large correlation between environmental exposure and the risk factors that are associated with those. So that does create a number of opportunities for Medicaid health plans, if you think about that. The opportunities of treating the problems and not the symptoms. And this goes further, and we've heard this from both of our guests so far on the show today. This goes further in talking about how Medicaid health plans are reaching more into communities, using more community resources as part of their care delivery model, and treating the problems and finding what are those environmental linkages that are creating the health disparities and trying to treat that or influence that in some way and not just the symptoms of it. That's certainly an opportunity for Medicaid health plans to look into. Community-based participatory environmental health research is another area that Dr. Gregg talked about as an area that is probably very underexplored or underutilized, and something that we want to be able to talk about and be able to work into the way Medicaid health plans are delivering their health care. And then sustainability community partnerships was the third area that he pointed to as being real opportunities for a Medicaid health plan. So it was a presentation that had just a wealth of knowledge, an area that I think very few of us have an opportunity look forward to or to look into and to be able to talk about, but something that probably needs to be looked at more than we have in the past. And that's just just an example of some of the presentations that are going on here that you might want to be a part of next year. The Centers for Best Practices excels in bringing these things to the forefront, and that's what we're honoring here today at this awards function. Those organizations, those people who have moved things forward in a way that others perhaps haven't, and in a way that is having a real impact in an innovative and creative way than in the past. Well, we're still waiting to hear the people that are going to be awarded the Cultural Competency Award, the Children's Health Award, and finally the Innovation Award. Already we've given out the Technology Award, and we've heard from United Healthcare, one of the co-recipients of that award. And then a little bit later in the program, we're going to be talking with the people who were the winners of the Outreach Award, which is the award that honors the best example of outreach that affected the lives of Medicaid enrollees. These are the kinds of things that the Best Practice Center is involved with. This is what you can read about at MHPA.org and be a part of when you're there. Well, in the compendium, there is just a tremendous amount of information about each of the best practices that are going to be honored here. We're still hoping that we can be joined in a few minutes by the folks from Midwest Health Plan. As I said, there's a lot going on today, presentations left and right. They're probably in there trying to get their hands around one of the presentations that's going on. Some of the outcomes that were part of the telemedicine services for medically complex children on the Navajo Nation that we heard about earlier, we're really making an impact in that population. If you're unfamiliar with it, it is a very diverse, geographically located population, very unique cultural implications, and I think that more and more Medicaid health plans are moving in the direction of fine-tuning their delivery models with respect to those types of considerations. So they were able to provide and create patient and provider survey results that delivered very favorable ratings and satisfactions as a result of that program. They were working to remove or to move that program into even more remote locations. We heard about that. And there are a lot of opportunities for those types of things that are going on. Now, the Midwest Health Plan, I have to tell you a little bit about the award that they won. The Midwest Health Plan was a co-recipient of the Technology Award, and their program was entitled Opportunity Knocks IT Listens, Aligning Health Information with Pay for Performance. Now, what they were trying to accomplish with this particular award was to improve, of course, the health of their population. They wanted to enhance the patient experience of care, not just get the care there, but the whole experience of engaging in it, and then they wanted to improve the delivery of those benefits. So they really are focusing in this particular best practice on a key alignment of IT to create an experience level type of change for their patient population, as opposed to just a clinical outcome change. Now, that happened too, no question about it, but it was much more involved than that, a very innovative way to approach it that maybe you don't see in other organizations, and certainly was worthy of being nominated for an award here. You might be wondering just exactly how are these awards chosen? And that's a great question. There is a board of directors that is part of the Centers for Best Practices. These are all key leaders in Medicaid healthcare. We just, again this morning in our first part of the hour, we talked with John Lovelace, who is who is the chairman of this event and of the Centers for Best Practice. That committee reviewed all 66 of the nominated best practices, and from that they decided which were going to be honored in each of the categories, and that's how each of these were chosen. So we're so Midwest Health Plan shared the Technology Award, And we're about ready to go to a break here. So when we come back in just a few minutes, we're going to hopefully they can step away and talk with us. If not, we're going to move on with some of the other award recipients. So there's a few more awards that have to be given out. We're going to hear from more of those award winners as our second hour starts, and we'll be back with you in just a few minutes to do that.
You're listening to Medicaid Matters on the blogtalkradio.com network. Are you a Medicaid industry expert, state executive, or thought leader? Can you share a perspective about the business of Medicaid that's unique, innovative, or even controversial? If so, you could be a future guest on Medicaid Matters. We are currently scheduling guests, and it's time to share your big idea about Medicaid. Go to our website and send us a message. Tell us what you want to talk about and how we can contact you. Make your voice heard. Make Medicaid better.
All right, and welcome back to Medicaid Matters, the only live talk show about the business of Medicaid. We're here live today at the second annual awards forum for the Medicaid Health Plans of America, and you can also be a sponsor of Medicaid Matters. It's not uncommon for several hundred people to listen to our program every week, each of them interested in Medicaid and your message. And if you'd like to know more about being a sponsor, then email us or call us at 615-257-1627. And also don't forget to join our community on Facebook. When you like the Medicaid Talk page, you'll get updates, access to contests like the annual bonus we gave away in January, and you can watch the show live and network with other in the Medicaid community. So just point your browser to facebook.com/Medicaid Talk, and you can be a part of there. Well, we are being joined now by Daniel Cave.
Hi.
And Daniel is the president and chief executive officer of Nurture. Did I say that right?
You did.
Okay, great. And the winner of the Outreach Award. Congratulations.
Thank you so much.
Glad to have you here with us today. Well, tell us a little bit about the Outreach Award. And it's quite an accomplishment. There were 9 different companies nominated in this award and 14 different best practices, and you came out on top.
So we're very, very, very excited about it. I think the program that we are doing, I think the best way to describe it is using every mechanism possible to try and find people who would benefit from the programs. And I think typically and traditionally the way organizations have done that is to reach out over the phone. And while we do that, and that is certainly a core element of what we do, we are increasingly using other mechanisms that are engaging for populations through technology, through the written word, or whatnot. And certainly that's, I think, an element of what attracted MHPA to our application.
Right. Right. You know, I've been to several conferences over the last year, and community outreach and engaging members in their community is a hot topic right now.
Well, that's absolutely correct, and I think if you look at some of the samples in the application, the compendium, you'll see that one of the ways I think community gets involved in this is the community of children. You can see some of the materials that we send out, and I think if you sort of you think about diabetes, it's asymptomatic, so people don't necessarily feel badly, or children don't feel badly with it. So you have to find a unique way to get them involved. And one of the ways, I think, as you can see, is through some of the almost comic book-like documents that we've produced for them that they find fun and engaging. And so the fun is the doorway through which we bring them into the program. They may not realize they're getting pulled into a diabetes program, but that's what's happening.
Not many kids are going to get excited about a diabetes program.
They are absolutely not.
Well, tell us, what was the catalyst that kind of drove the drove the need to create this initiative and this best practice?
Well, we're owned by a company, a Medicaid health plan, Centene, and
Right.
and certainly the prevalence of diabetes in the populations we serve is enormous. It's extraordinary, and so we've always felt that we needed to do various focused programming for that population, not just for the fact that diabetes is a tremendous cost burden, but it's an enormous quality burden on people's lives.
No question.
So when we started this program, it's been in operation now for several years. But I do believe that we had to somewhat feel our way to make certain that we were engaging everyone. And the results speak for themselves. I mean, we've had a 26% reduction in diabetes-related hospital admissions as a result of the program.
That is significant.
It's fabulous. And when you're doing that not only with adults but also with increasingly with kids with getting diabetes, it's just an incredibly rewarding thing that we do every day.
No question. Now, this is the part of being live at a remote, and you don't have a lot of control over your environment. I'm going to have to ask you just to step a little bit closer to tell me that some of the background noise is starting to come about. So you have to do that a little bit sometimes.
Okay.
Well, how long has this program been in existence now?
Well, we've been running the program, let me think back here, since 2006, 2007.
Okay, so quite a while.
It's been in place for a while, but as I noted, we've just added some of the, you can see some of the very engaging materials, particularly for children, in the past year or so. Prior to that, it was much more of a traditional telephonic outreach all the time, and but these materials have really proven to be additionally effective.
Now, how many people does this touch?
This touched, when we did this study, we had over 6,000 people that we were touching in various locations in Medicaid across the country.
Okay.
So the results that we were presenting, the 26% reduction in hospitalizations, was related to that cohort of 6,200, I believe, give or take, patients.
Is this a program that is going to kind of remain in its current form, or is this kind of built as a model that's going to be expanded and rolled out?
This program has a life of its own, and frankly, we're running several programs like this. We're running asthma programs, and we're running heart disease programs, and if we let them stay still, they truly become stagnant, because the world of engagement in populations is constantly changing. The next wave is smartphones, and we know that especially the younger generation of individuals in our country, whether they're Medicaid recipients or not, smartphones are becoming increasingly a way that they interact.
Yes.
And so having the ability to engage people using technologies is going to be something that we will increasingly look at. We're actually running a very small pilot today in one of our health plans with that type of technology. But I think that's just the beginning. I think there are other mechanisms. We have a phrase we use at our company called emotional destinations, and we think that people really will change health behaviors mostly for an emotional reason. It's hard to change health behaviors.
Oh, yes.
It's very, very hard. Right. And people will generally not just do it just to lower their blood. Right. Because knowing that they should do it isn't the issue. It's really getting them motivated. So helping them find what they will get emotionally from better health is really what we find to be most engaging. Great example of that is a person who may be in their late 50s, early 60s, may have diabetes, may have heart disease as a result of that diabetes. Lowering their blood sugar for them is nice. Lowering their blood sugar so that they don't die prematurely, so that they get to see their grandchild get married someday, that's engaging.
That's right. Absolutely right. And I know the listeners and viewers of our show know that I've been a strong advocate of personal involvement, personal responsibility for health as the real key to changing the healthcare situation that we have in our country right now, particularly with respect to things like diabetes, with respect to obesity and things of that nature. So, having a program like this where you're really engaging people at that emotional level, that is what's going to cause a change in behavior.
That is. Well, the people in our company know I have a saying of, why aren't we in better health? And we could ask this of almost every single American.
No question.
And we all could be in better health. And the reason is typically not that we don't know better. Right. Sometimes it is. Sometimes it truly is. But oftentimes it's about our lives. Mm-hmm. Something in our life is taking higher priority than our health, mm-hmm. or we don't have enough motivation. And so when we look at Medicaid recipients, especially with the unique and very, very challenging socioeconomic circumstances mm-hmm. in which they're living, the need to find those emotional reasons to change health behaviors in a long-term sustainable way is even more compelling.
Yes. I had one of our clients tell me one time, I can't get people to take their medicine if they're worried about not having anything in the refrigerator.
That's exactly correct.
Isn't it?
That's exactly correct.
And that's one of the really unique things about working in the Medicaid population, is that it's not just about health. I mean, they have so many factors that impact their health beyond just getting to the medication or beyond being able to see a primary care physician. Right. There's just a lot of different things that are involved, and having something like this where you're just engaging in unique ways and at that emotional level, that's the key.
Well, and it's emotional for us too. I have to say, we have the greatest reward we have in our company is once a month we have an all-employee meeting, or once a quarter, I guess it is, and we end each of those meetings with a blinded case study where we'll remove the individual's name mm-hmm. for patient privacy reasons, and we'll read about some incredible change that the individuals that we serve have made in their lives. Mm-hmm. And it's extraordinary to see the look on our team's faces, the tears that come to people's eyes. Yeah. We have examples of some of our employees helping folks who have asthma find a new living situation, so you don't have to live with carpets where that are helping cause some of the asthma,
the fibers
exacerbations.
Right.
So just the fact that we get paid to do this for a living is remarkable.
Yeah, it is.
It's people would do their jobs in our company, I think, almost for free.
Yeah. Almost for free. That's right. But it makes it very real.
It does.
It makes it very real. Does. Tell me a little bit about Nurture. I'm not familiar with the organization. I think everybody of our listening and viewing audience is familiar with Centene.
Right.
Was Nurture a company acquired by
Centene?
So
we actually were acquired. Centene in 2005 and 2006 acquired two companies at the time that were disease management companies. One was a company called Airlogics, mm-hmm. Located in Texas, and another one was a company called Cardium Health in Farmington, Connecticut, mm-hmm. I was the CEO of the company in Connecticut. We brought those two companies together and then really reinvented them beginning in 2007 and 2008 into Nurture. And we've since acquired a few more businesses that are all part of our executing our long-term vision. We call our vision people care, because while this is a diabetes program, I don't believe that what we're really doing is managing diabetes. Mm-hmm. We're really helping people who happen to have diabetes, and they happen to have heart disease, and they happen to have other elements or other conditions as well.
I'm sure diabetes isn't the only thing they're dealing with.
Exactly. So people care is really a different type of a way of looking at health coaching, where the person becomes what we're trying to help, or who we're trying to help change behaviors. We're not really managing the disease. They have to manage their disease.
Right.
So and people care looks at three things. It attempts to educate people who may not know, may not know better, but it really attempts to help them with their lives so that they can make health a priority. And then thirdly, it brings to bear motivation techniques, because even someone who knows better, whose life is perhaps in order, still may not be able to get off the couch.
That's right. Yeah.
So that's what Nurture does. We're almost 400 strong now. when I was part of Cardium Health and we sold the company, I think we had about 50 employees.
Wow.
So we've come quite a long way.
That's a long way, yes.
We've come a long way, and we are a wholly owned subsidiary of Centene.
Okay.
We certainly service Medicaid. We also service commercial clients.
Okay.
So we have many large employers in the country. So we're able to, quite honestly, look at the issues that the healthcare issues that affect Medicaid recipients and commercial employees. Remarkably, it comes down to those three factors: education, life, environment, and motivation.
Yeah, no question.
So,
and it's for everything we do in life.
It is
it's
absolutely
for everything.
It absolutely is.
Well, what's next for the program?
Well, I would say more expansion in two ways. Certainly, Centene's growing, and we're very excited about all the many more people we get to provide the benefit of the program to. But I would say the program is going to be growing as well, and as I mentioned, this sort of vision of we're managing people, and the program happens to be the doorway into the behavior change service that we provide. So the program will look to open that door to more and more people. I think what keeps me up at night, what keeps people up at our company at night, is the fact that there are still folks that we haven't got yet.
That's right.
We haven't engaged them yet, and we haven't helped them yet. And those are the people that, it's great to receive awards for all the great work we've done, but there's still people with diabetes that we haven't gotten to.
Yeah.
And we're really not going to feel good about ourselves until we have all of them. Well,
it's obvious that not only is your head in the right place, but your heart's there too.
Well, I tell our folks, our employees all the time, if you don't get juiced and you don't get tears in your eyes when you hear those discussions that we do, find another job. This is a remarkable business, and it's a privilege and an honor to service the people that we're servicing.
That's the way we need to approach it, no question. Thanks for joining us.
Thank you very much. It's been a pleasure.
And congratulations on the award.
Thanks again.
We'll talk to you soon again.
Yep. Take care.
All right.
Now.
You too, Dan. That's Daniel Cave, President and CEO of Nurture. And Nurture was the winner of the Outreach Award. And we're going to keep joined again through the next 45 minutes here for the people who have won both the Cultural Competency Award and we still have the other awards to go to. Have a seat, ladies. How are you doing? All right. We are now in the honored presence of the recipients of the Cultural Competency Award. Is that correct?
Yes.
All right. They're trying to keep me on track here. I'm not. We got a lot going on today, so forgive me if I'm not all over the place. Well, would you now? Here's something we have to be conscious of. We're in an open environment here, so normally our show is done in a studio in the offices of my company, so we can't control a lot of the background noise. So I'm going to have to ask you to speak pretty close to the mic when you talk. But would you introduce yourselves to everyone, please?
Hi, my name is Curlin Jones, Vice President for Government Relations and Compliance at Health Partners.
And that's Health Partners of Philadelphia.
Yes, Health Partners of Philadelphia.
Right. There's another Health Partners out there. I want to make sure everybody knows which one.
I'm Tashira Ayers, Senior Community Relations Specialist, also of Health Partners of Philadelphia.
Good.
Hi, my name is Felicia Phillips. I'm the Supervisor of Communications at Health Partners of Philadelphia.
Well, it's nice to have you here on Medicaid Matters. Have any of you ever experienced the show before in the past?
No.
Okay, all right. Well, it's your first time. Good. You'll have to do it again soon. Tell us about the program which just was awarded.
Well, the Crazy Praise Dance Showcase, also known as CPDS, is a program that we started about 3 years ago, and it serves several purposes. When we actually sat down, thought about something that we wanted to do to tap into our minority community, which makes up over 51% of our member base, and that is the African American community. And we also wanted to promote a message, a holistic message of health and wellness, and we found that the art form of dance is very common in not only the African American community, but other communities we serve as well. And so Crazy Praise, or CPDS, is a way we've gotten over 2,500 people into one setting, not only providing entertainment, but also complimentary health screenings. We're able to deliver a message of health and wellness, faith-based, again, through the form of physical activity. It also served as a means to launch our CHIP program a few years back. We're now a provider of CHIP, and it's been a great success. It's been a great success, and we're very appreciative of the award.
Yeah, well, it's certainly a great honor, too, to be a part of it. And I want to let our viewers know that after we finish here, you're going to demonstrate one of the phrases from the
Only
dance.
if you demonstrate with me.
I'll do it. I'm up for it. So how are each of you involved in the program?
Well, since I take care of the government relations and compliance area, one of the things that we have to do on a consistent basis is review all the information that Tashara would have come up with. You know, if she came up with a basic white paper to describe the program, we review it and take a look at it and see if it really promoted the health initiatives that the Pennsylvania Department of Public Welfare was really looking at promoting through their program called Health Choices, which is a mandatory Medicaid program in Pennsylvania. Any of the initiatives that you do, it really has to promote health, and it can't just be a simple marketing tool. And Tashara was very eager to get this program approved, so we went through, what ifs and why not, and so on and so forth, until we came to a program that we really felt gave the Department of Public Welfare what it needed, and it also promoted a really different way of looking at things, which is what the department is also looking for, innovation. So we submitted it through the Department of Public Welfare, and that would go through my area, which is how I got involved.
Okay.
Plus, I enjoy working with Felicia and Tashara.
So basically, we can't do it without their permission.
I see.
And they like me.
You must write the checks too, right? No.
And Felicia, she introduced herself as supervisor of communications, but she also played a very intricate role in planning everything. I kind of pulled her out of just like the communications part and made her help me plan too. So.
Yes, we actually came up with the concept and idea for Crazy Praise about 3 years ago. Actually, Tashara was new to Health Partners and was charged with developing a program that would deal with obesity and physical fitness and targeted toward the African American community through faith-based initiatives. So I actually thought of an idea of doing a dance showcase, came up with the name of the event, shared it with Tashira. We both took it from there, and it just continues to grow each and every year. It's a wonderful event. We have, in addition to the showcase that Tashira mentioned, where we bring in Grammy award-winning gospel artists to perform.
Oh, wow.
We bring in praise dancers from throughout the city so that people in the local community can see that dancing, even praise dancing, is physical exercise. You can have fun and you can stay fit. And we also have a health fair. And the health fair allows us to outreach also to our community beyond just our general membership. So we do body mass index screenings. We provide health information. We have activities for the children. So it's really a fun family event that promotes health and wellness. We're really excited about it. Thrilled to do it each year, and it's just been wonderful.
And it's an all-day event. It starts early in the day when you talk about all the different health promotions. It goes through, we provide a small daycare for the children. Like they can do coloring and face painting, and so that the parents can go into the different vans or, observe all the different health initiatives. And then it goes into the Crazy Praise Gospel concert, and that's in the evening. And we provide just a really good atmosphere, and it's just wonderful. Everyone just really gets excited about coming, and every year it's gotten bigger and bigger. So
is it an annual event?
It's an annual, and it's free.
It's free.
It's free.
Yes.
Okay.
Open to the public.
Open to the public, not just Health Partners members.
Okay.
Just run out
Now,
every year.
I'm curious as to, because sometimes when you have something that is somewhat religious in nature or faith-based, and then you're dealing with a state program and so forth, it seems like somewhere along the line somebody raised their hand and said, hey, is this the right thing to do? Did that happen, and how did you handle that?
Yes and no. Yes, meaning, we had a few hands raised, but there wasn't an overwhelming concern, if you would. I think what we've been successful at is, although it is faith-based and it's driven by Grammy Award-winning gospel artists, in the marketing and promotions and even in conversation, we don't push the faith component on the public.
Mhm,
You know,
yeah.
it is evident, it's held in a church, but like we have the health fair piece as well, which
Mhm.
is held outside,
Mhm.
and so it hopefully it makes people feel more welcome, and we've seen that in the numbers each year as they've grown. I think that everyone agrees, meaning our employees, our senior staff, our community partners, that there is a very large audience, the African American audience found in the faith community.
Yes.
No matter what faith or religion
Mhm.
you are, they're there. And so we are also working to tap into other faiths as well, not excluding anyone. So
Good, good. Yes.
I think that the bottom line is that Health Partners does a really good job of going out into the community. We go where our members are. Our bottom line is improving member outcomes. And so going into the faith-based community or tapping into the faith-based community just gave us another vehicle to reach our members. We know that they're there. We know what will draw them. And so that's what Crazy Praise was all about.
You know, we do this show every other week, and almost every guest I've had, I'd say for at least the last 6-7 months, has talked about how they are integrating community resources into their delivery model, and you know, which is it's been done in the past, but I don't think it's been as prevalent as it is today. And it's really encouraging to see, you know, an organization like Health Partners going in and engaging the community like that. How involved are the churches and the faith-based organizations in this? Are they just providing a facility, or do they get involved in planning, promoting, what?
Pretty much from soup to nuts. I mean, they provide the facility. They are the dancers. They come from the churches. We recruit from churches we have relationships with, and we also constantly work to develop new relationships as well. The Mayor's Office of Faith-Based Initiatives in Philadelphia has been a great supporter and partner in this.
Okay, yeah.
They've been able to blast the information out to the city. 3,000 plus organizations and pastors and clergy members represented. And again, that's across all faiths. So they're very present. They're very, and they're available also for us. They've reached out and said, listen, if you need us to reach into another portion of the faith-based community, we're here to do that as well. So they're kind of like our arms and our legs, and they help us pound the pavement. And it's really beginning to really catch on fire. We have a local station, Praise 103.9, which is with Radio 1, Philadelphia, and they are phenomenal in supporting us. This is actually, I have to say, it's one of a kind. We've had some duplicates, but nothing like the original.
Oh, good.
So we're proud.
Good.
Yeah.
I also think one of the things that Tashara and Felicia do is that Health Partners is in 5 counties in the southeast region of Pennsylvania, and even though we are many of our members come from the Philadelphia County, we have gone out to the other 4 counties and asked their faith-based initiatives and programs to come. And I know for a fact this year we were able to get Delaware County to come in, and many of the pastors and religious folks from the city of Chester were able to come and see what we were doing for our members and promote it to their members as well. So we've been able to reach out beyond Philadelphia County, and that was really good this year. So we look forward to doing even more this coming year.
Oh,
we're putting even
fantastic.
more pressure on Tashara and Felicia.
You're the promoter, right? I understand how that goes. Well, when you think of when this first started, there was obviously some issues you were trying to address and overcome, and this has been going on for how long now?
3 years.
3 years.
Our 4th year.
All right.
Yes.
So what has changed as a result of this program?
Great question. Well, the goals that we had during year 1 are similar goals, but they've just expanded a little. Like I said, one of the things we wanted to do, or we used it for, was to launch our CHIP program.
Right.
And we've grown our CHIP line of business to, do we know the number? Over 3,000. Okay, in the last 3 years.
So from nothing to 3,000.
Exactly, in 3 years. So I would say that we can contribute some of that to Crazy Praise each year also. And as in addition to that, for the health fair component, we have HEDIS measures that we are required to meet. And so it's not just entertainment, which is great, but we also have the screenings, and we also have non-compliant members that we welcome to come to the health fair, that we have to ensure that they come into the compliance range, if you
Right.
would. And we help them by doing so, not just with Crazy Praise, but during the course of the year, we hold a series of events and we invite those non-compliant members, and they're non-compliant for a variety of different reasons, whether it's because they don't have access to their primary care physician, they may just be afraid to go to the doctors, they don't have their regular screenings, and we say, hey, for coming out to this location for purposes of Crazy Praise, it's a faith-based venue, come have your blood pressure screened so that you can understand why your numbers are what they are. We also provide education after the screenings are complete so that they can understand what they need to do to get into a compliant range or a healthy range. And so in that, we've seen a high level of non-compliant members, which if you do this year after year, you start to see familiar faces. And on one hand, it's like, you're happy, you want to be friendly, but you don't want to see these faces every year because it kind of says that they're still in a non-compliant range. And I have to say, in the last year, I've seen a whole new set of new faces. And so in addition to the CHIP goals, I think we've been really great at not only providing access to screenings, but also educating members on the importance of maintaining those levels between, year one and year two, and so forth and so on.
Okay. We just have about a minute and a half before we go to our next commercial break, so I want to ask one last question, and that is, what do you think set this program apart from the other 5 that were nominated for this award?
I would have to say that, and I'm biased, of course, that it is absolutely innovative. When we have this event each year, last year people were tweeting about the event, and we hear what people have to say about it. They're amazed at just watching the quality and the level of performances from both the gospel artists and the praise dancers. We get up and we see these children that are just so energetic and are moving, and we then see on the news that obesity is a big issue, and it's like, here's an answer, and it's right here in our church for those that are in a faith-based community, so they can make that connection between physical activity and, again, even that combination or that holistic approach to health. So I think that's what sets it apart. I think that we bring stellar performers each year, the fact that we bring in the community so that they're able to get tested and get health information, and then that we are just telling people about our children's health insurance program, Kids Partners. There are thousands of uninsured children who are eligible for CHIP and don't even know about the program, and this is available to them. So people are really appreciative of the opportunity to find out that their children can indeed get health insurance, particularly during these really dire economic times. So
Great. Well, congratulations again on winning the award. It's obvious that you all 3 have a real passion for this program.
Is it?
Yes. It really, but that's what it takes. I mean, this is not the easiest group of people, population to work with and to engage with for things that are, better for their health, for a lot of different reasons. And it takes people like the 3 of you with passion to meet that need and to make a difference in their lives. So, if nothing else, you should get an award for that.
Oh, thank you. Thank you.
Well, thanks for being on the show today, and Charlotte can tell you how to see a replay of it if you want to see it in the future. All right.
Thank you.
Congratulations
Thank
again.
you.
Yeah.
Thank you.
Pleasure.
Take care.
Thanks.
Thanks a lot.
You're welcome. Thank you. All right. Well, we're going to go to our last break before we finish the show. We have about 30 minutes left in the show today. Maybe you have a best practice that we should know about. We would certainly like to hear from you. So we'll be back. Please stand by.
I hope you're enjoying today's show, and I want to remind you that opinions and viewpoints expressed by guests on the Medicaid Matters Talk Show are not necessarily those of the host or our sponsors. Thanks for listening, and we'll be back in just a moment.
By providing access to the care they need and the quality they deserve, Medicaid health plans enhance health outcomes of our nation's underserved. Just listen to how a Medicaid health plan made a difference to Miriam.
I was 10 years overdue for my annual mammogram when my Medicaid plan case manager called and convinced me to just do it. The mobile mammography van my plan provided made it simple. Breast cancer runs in my family. That phone call may have saved my life.
Medicaid Health Plans of America, ensuring access to better health care. Learn more at MHPA.org.
And this is Medicaid Matters, the only live talk show about the business of Medicaid. We're here almost every other Tuesday at 1 p.m. Eastern. Today is a special day. We're talking about best practices. These are ideas that are being put to use today and in some ways solving some of the toughest problems in Medicaid. The Medicaid Health Plans of America Center for Best Practice invites you to join their Insights webinar series. Starting in March, this past March, they kicked off the first webinar, and these series will be running through December 27th, 2012. And you'll have an opportunity to sit on 20 one-hour presentations from the following 6 top-line subject areas: hot trends and topics, improve your operations, risk adjustment, clinical best practices, compliance issues, and dual eligibles. The specific webinars offered include impact on revenue and quality of care, improving member retention, and many, many more. We're going to give a listener a chance to win one of these webinars, compliments of managed Medicaid services. Already, one of our listeners has been awarded a $150 value for this seminar, and we're going to give another one away. The way to participate in that is go to MedicaidTalk.com and register for our blog. You're automatically entered when you do that, and we're going to be giving away another webinar here very soon. So make sure you get registered. Well, we are joined now with Kathleen Harkness, who is the Senior Director of Corporate Quality and one of the co-recipients of the Technology Award. So welcome.
Thank you.
It's good to have you here. Well, tell us a little bit about the best practice that you were honored with today.
We were honored for our what we call our opportunities reports. Back in 2008, we were hand delivering and mailing lists of patients who were overdue for services to their primary care physicians. This was costly and time consuming. And at the same time, we were developing a pay-for-performance program based on HEDIS measures like performing mammograms, pap smears, childhood immunizations. And those were the type of lists we were sending to our doctors, letting them know what members were overdue for those services, and if they conducted those services, they would be paid bonus money.
Mm-hmm.
So at that time, we were also enhancing our website. So our IT department worked very hard and developed what we called opportunity reports. So the title of our submission was Opportunity Knocks, IT Listens, because we worked very closely with them to develop a pay-for-performance program where all of the providers could go easily onto our secure part of our website, look at all of their membership, and see what services they were due for. And these services were based on, preventive services and clinical services based on nationally recognized guidelines. So it's easy for the doctor to go in, and he could have an Excel spreadsheet of all of his members, and if it was an opportunity for him to get that member in to do the service, there was an O for opportunities. And if he had conducted it, there would be an X. And that would mean he got paid for those services with the bonus money. So we developed that in 2008. We spent a lot of time over the next couple of years educating provider office staff and the doctors on these reports, how to use them. We also developed, besides this spreadsheet, a PDF single sheet that the office could print out, place in the member's chart, so when the member came in, the doctor would know right away what services they were due for.
So they essentially just can log into a portal and get what they need? Is that how it works?
Correct. There's a secure part of our website. They have a password to log in. They can go and see all of their members and get the information right in front of them. The office has access then to their address and phone number, so they don't have to pull the chart. Our information is real time. It's based on claims, immunization registry, encounters, and it's updated daily, so it's up-to-date, real-time information for the providers.
Well, what problem were you trying to solve that created this program?
It was time-consuming for the staff to mail out all of these lists to the doctors. Sometimes we'd hand-deliver the list. And I hate to say it, but sometimes I'm sure as soon as we left, they dumped the list into
it was all on paper.
The round pile. It was all on paper, very cumbersome. So in order to decrease staff time, move to the 20th century, we put it on the website. And we've gotten great feedback from our providers. They will call if by chance our website may be down for an hour. They'll call and say, hey, what's going on?
They're looking at it.
and we're happy they are looking at it.
Yeah.
And since 2008, all of the measures in our pay for performance to 2011 have increased. The rates have increased, and we think it's part and due to these opportunities reports that we placed on our website that the office is looking at, the doctor's looking at. And there's constant reminders anytime our provider service reps go to the office or our nurses are in the office. We also remind them about the opportunities reports because it's good care for the patient.
Oh, yes.
It gives the doctor bonus money.
That probably got their attention then.
It does. Money usually gets their attention.
That's right. That's right.
But the bottom line is, I think we improve the care to our Medicaid recipients.
Well, yeah, if the doctor's more informed like that, then certainly they're going to get to the things that need to be done.
And we also offer member incentives, so we have, the members engaged in trying to get the right care too.
Oh, very innovative program. Now, what's the next steps for this program?
What we want to do next is actually tie the money that the doctors have earned so far to the money that they can earn. So when they pull up the spreadsheet, they can see, I have another $5,000 I can earn for my practice if I do this.
Yeah. Do you have doctors that are like advising you in some way on how to design this?
We have a couple of doctors that we work closely with and give us good feedback on when they think we do things correctly and when they think we don't do things perhaps as correctly as they think we should. So we do have physician input. And we have office staff input too. And we've taken their suggestions to heart. Like they wanted the address on there, they wanted the phone number. So their suggestions we do take into consideration and usually do implement them.
Yeah. Well, the closest to it usually have some of the best ideas.
Yeah,
no
they
question. What do you think made this program stand out so far and above all the others that may have been nominated that caused the committee to pick this?
I think it was the outcomes. All of the 16 HEDIS measures that we have in our bonus program, all of them improved. Our rates improved greatly, as well as the cost savings to the plan. I mean, we're a very small plan, but we spent over $25,000 a year doing these hard copy mailings, hand delivering. Yeah. So it was a cost saving to the plan. And, it was...
Well, congratulations.
Thank you very much.
It's well deserved, and we're really glad that you had a chance to stop by and talk to us about it. I know our listeners are very interested in technology applications and how that's improving operations and clinical outcomes.
Well, thank you very much. I appreciate the opportunity.
Good. Nice to have you here.
Thank you.
That's Kathleen Harkness, who is the Senior Director of Corporate and Quality with Midwest Health Plan. Thanks, Kathleen. Thank you very much. Well, we've spent a day of just continuous awards being given out, as you can hear just from the guests that we've already talked to, that there has been a wide variety of different initiatives that are making a name for themselves in Medicaid. We're now being joined by Joel De Jesus.
Yes, that's
right. Did that correctly? Great.
Yes.
I'm doing fine. Good. With Magellan Bioscience. Joel and Magellan Bioscience are the recipients of the Children's Health Award, one of the 6 awards being given out today. And Joel, thank you so much. And
one of them.
finally,
yes,
no, set it up right here.
I think it's
so everybody
everyone's
can
protecting it as
yeah,
much as possible.
I've asked every guest to bring one by so that our viewers can see what it looks like. This is very similar to what all the awards look like, and you can tell it is an impressive award and an impressive accomplishment.
Oh, thank you. What a wonderful program.
It is
second annual program, and it gets an N of 2. It gets better every year.
Yes,
so
no question about it. And it's it's really interesting to see all of the different ways these different companies. I mean, there are over 12 different companies nominated here, 66 different best practices nominated, and that's a lot of innovation that's going on.
There is. I think there's a true desire to improve outcomes, and of course you hear about the problems of what's going to happen when a lot of enrollees, and look at the current problems we have. I think a program such as this by MHPA shows that there are innovations, not only from a technical standpoint, but also from a practice standpoint, that deserves to be recognized and replicated. I think that's the whole purpose of this, is to highlight those practices that should be replicated to help find solutions.
Well, I think everybody recognizes the Magellan name from a behavioral health standpoint. Tell us a little bit about the bioscience.
The bioscience, Magellan has morphed a little bit in the past couple years. Right now, Magellan is focusing on the childhood-led childhood lead testing. So it is, if you kind of look back through the history, we've had numerous products in the U.S. that contain lead gasoline, lead-based paint. So we know that it's still around. There's been some strides to find the locations, and I think we're now in the U.S. down to certain locations that have higher risk of childhood lead poisoning. We have a 3-minute point-of-care device that is critical to collecting data for the CDC to determine where resources should be diverted towards to make sure that root cause type of solution can be found, or to find root cause and then to solve it. So that's what Magellan's focus is right now. We certainly believe in the cause, and we know that right now there are pockets within the U.S. that needs to take a look at their lead problems. Just last week there was a USA Today article that looked at old smelting plants. And they've highlighted and tested the soil, and even the soil is contaminated.
Oh, I can imagine. Yeah.
And guess what kids play in?
That's right.
In the dirt.
Well, tell us about the award, the Children Health, not the award, but the program, the best practice that you won this award for.
Yeah. So I'm especially proud of this award because I think unique to this program, it truly is a partnership and a strong collaboration. So. Representing Magellan as a tool provider, realistically, we can't accomplish a best practice without our partners. And to a large extent, it's these partners' ability to break down silos and break down barriers to pull together a program so that we can do testing at the sites where the kids are. It's very difficult for Medicaid kids to go to their physician's office if they have a physician, get a prescription, and then go to a lab. Instead of an analyzer such as ours in Land Care 2, where it can be done in alternate locations, even on the road in health fairs. So the program pulls together, in this particular case, in Milwaukee County in Wisconsin. It's a partnership with 4 health plans. So different than some of the awards that you've seen. It's actually 4 health plans and 2 government agencies. And so the thing I'm most proud of this award is that it's recognized that working together can certainly accomplish a lot of good. The health plans that had participated, led by Sandra Makhorn of United Healthcare of Wisconsin, Children's Community Health is a second. We have the Centenes, Manage Health Services, as well as the Molinas. I'm forgetting.
Health Plan of Wisconsin?
Yeah, well, no, it's Abby.
I know what you're talking about.
Yeah,
I can't think of the name of it.
But yes, but they have a health plan as well. So 4 health plans that are typically looking to jockey for a position, all chipped in. The WIC program, which is funded by the Department of Agriculture, work together with the state to make sure that reimbursement can happen. WIC is where the children are that need to be tested. And so if you get WIC, and Marilyn Bolton, who runs that program, is an extremely great leader that breaks down the barriers, that pulls people together to make sure that the funds are flowing correctly, the children are flowing correctly, and the data is flowing correctly. And the data then goes to Margie Coons at the state level, at the Wisconsin Childhood Lead Prevention Program. So it is a cross-section of government agencies and health plans, and us as a tool provider that makes things happen.
What's next steps for this program?
Well, we've picked up some traction on this type of program. So we're talking with other cities, Houston being another one that's looking to replicate the program. So we've had several meetings in Houston with the same groups of folks. There's also another program that's up and running in Michigan. There's one that's being talked about in the outside of the Atlanta area in Georgia. So we're picking up a lot of steam in terms of and this is what should happen with a best practice. You take what's happening in Wisconsin, gets modified for a different location, and it starts to spread in the pockets where it needs it the most. It's not a national program where one size fits all. It has to be tailored down to the local level because from a Medicaid standpoint, that's where we can do the most good.
Yeah. I'm curious how, the Supreme Court is considering a lot that's going to impact Medicaid. If they rule that the Medicaid expansion, as some states would say, coercion in ACA is unconstitutional, What kind of impact might that have on this type of program?
I think that if they were to say that it's unconstitutional, and there's always the issue of severability as well,
Right.
along with that. My personal opinion, not speaking for Magellan, but
Sure.
my personal opinion is that starts a big trickle downfall of a system that is starting to progress us towards healthcare for everyone. If that were to happen, I think we should all be fearful of programs that may not get funded.
Right.
So, for example, right now I can tell you that there is concern, let's talk specifically about lead just for a little bit, that the CDC has lost funding for the Healthy Homes and the Childhood Lead Prevention Program, who is at the crux of determining root cause for where lead exposure is. It's great that HUD has some money, but without the CDC's funds that go directly to the state and the localities that we were just talking about, it's very difficult to find the root cause, then to deploy other resources, financial resources, to remediate the problem. There's a lot of groups. I just came from a meeting last week at the National Minority Health Forum that showed how many folks do need health insurance and what happens as a burden to the rest of the United States, where if there isn't an official channel through Medicaid for personal health insurance, that we all pay for it.
Right.
And I think that there are some groups that are starting to mobilize. A little bit too late now that it's in the Supreme Court.
Yes.
But that raises a lot of concern in the minority population, and there's a great concern in the Tri-Caucus in Congress. I believe that this may not be happening. And the reality is, I don't think there's a plan B.
Yeah, no, I don't think there is either.
Yeah, so I think we need to support the plan A. I think that it needs to be upheld. And your plan B then becomes support plan A.
Yeah. Yeah, I think it's not plan B, it's square one.
That's right. So I think that if it doesn't get upheld, we're actually moving backwards.
Yeah, it's a very real possibility. It's going to be very interesting at the end of June to see how this comes out.
I'm looking very carefully as far as what happens.
And it's certainly a hot topic. We did a show 2 weeks ago on the future of Medicaid and the Supreme Court ruling, and really explored, all right, so what does happen? And it was probably one of the most listened to and downloaded shows I think we've had in probably 6-7 months.
Yeah. I think what my fellow Americans can do is to really educate themselves on what is at risk here.
Yeah.
There is a lot of there's a lot of sound bites, from folks that hold office, and the clarity as far as what it is missing. So I don't think anyone is going to look at the bill that's some 800 pages long.
Yeah.
And I think that we owe it to, I think that our public officials owe it to the American people to give a straight answer as far as what does this actually do, instead of the bits and pieces that are almost impossible to connect. And I think we have a very confused population.
Oh, yeah, I think so.
Makes it very difficult to understand what the consequences.
Yeah, no question. Well, Joel, congratulations again on winning the award.
It's a great honor.
Yeah. Is this going to go home on the bookshelf, or?
Well, I'm going to bring it back to the corporate office. We are moving in a little bit, so I will make sure that the folks planning have at least a trophy case.
That's right. Well, it needs to go in there. No question about it. It's a beautiful trophy. And,
yes, it is. It's very heavy as well.
The program sounds like it's really making great progress, and should be proud to be part of it.
We're quite proud of it. We're quite proud of it. We're very proud of our partners as well, because they are the fuel that makes it happen.
Yeah, no question. Well, thank you again for being a part of the show.
Thank you.
We'll hopefully talk to you again in the future about something like this. All right,
great.
Well, that's Joel De Jesus, who is VP of Business Development for Magellan Bioscience. They're the recipients of the Children's Health Award, one of the 6 awards being given out here at the Medicaid Health Plans of America Centers for Best Practice 2nd Annual Awards Meeting. One more award to be given out today, which is the Innovation Award. And I think the program's actually running just a little bit behind, so we may not have an opportunity for that award winner to be a part of the show. But there are quite a bit of different programs that are in contention for that particular award. Trying to find some of my notes here. Again, we've got a lot going on here, so forgive me if we're running just a little bit behind on this. Yes, I got it. Thanks. The Innovation Award is an award that is given to the Medicaid health plan with the overall best practice for 2011 through 2012. Now, there's quite a lot of opportunity for this award to be given out. I'm going to give you a rundown of some of the things that were nominated. There were actually 8 companies that were nominated for the Innovation Award, and a total of 17 best practices. Okay, I'm getting word now that they have awarded the Innovation Award. No, we haven't done that yet. Okay, sorry, we did not get that information yet. So there were 17 different best practices that were nominated for the award, and some of them include WellPoint for promoting healthier lifestyles. And if you're wondering, I'm looking through the compendium, the 2011-2012 compendium. Horizon New Jersey Health for Provider Recognition Award Dinner, also for reduction, best practice in the reduction of emergency room visits from Horizon New Jersey Health. WellPoint also represented again in this innovation category with the Right Choices program, and for a school nurse program from Horizon New Jersey Health. United Healthcare Senior Options was represented in the award with the Senior Care Influenza Immunizations program, and a Sesame Street Doll lead testing incentive. So we've heard already an award for lead testing given out here at the Medicaid Health Plans of America second annual awards forum, and United Healthcare being nominated for a similar, well, I shouldn't say similar, but a program on the same topic as well. They also have a Food for Thought and Eating Well on a Budget program, which I think a lot of people will take for granted that that's not as big of an issue as it is. But I've had more than one guest tell me on this show that they cannot get compliance from their plan members on taking medication or visiting a physician if they're concerned about where their next meal is going to come from. So certainly an innovation and an award or an innovation and best practice toward helping resolve that problem with something that we certainly want to make sure that is recognized and that we understand. Obesity Reduction Project, another innovative or best practice nominated for the Innovations Award from United Healthcare, is also one that is going to be considered. Spina Bifida and Spinal Cord Injuries Initiative from UPMC. UPMC already winning the Making a Difference Award this morning as the first award that was given out. They're up for an Innovation Award as well. And Centene Corporation, Start Smart for Your Baby, the 17P program to reduce prematurity, another one up for nomination for that award. So as you can see, the awards cover a big spectrum of information. Hang on just a second. It's been announced. Okay. And I'm learning now that the Innovation Award has just been announced here. It is promoting healthier lifestyles, which is an award granted to WellPoint state-sponsored business. And if I can find some information about that, as luck would have it, I'm right on the page where that award was. This is an award that was designed to address some challenges such as 1 in 3 low-income children being overweight or obese before their 5th birthday. Minorities here are particularly at risk in this. These children are more likely to turn to Medicaid for their health needs, and healthcare expenses are nearly twice as high for an obese child covered under Medicaid versus private insurance. So as you can see, that's an issue that has to be taken care of. So they approach this in their best practice, and this is extensively described in the compendium. So if you want to know the details of this, I recommend you get the Center for Best Practices compendium. But it was an award that, or it was a program that really addressed the issues of childhood obesity, and certainly that's an area that our country, not just in the Medicaid population, but an area that our country needs to address overall. Well, we're about to come up to the end of our program here. I hope you've enjoyed us being here. We've been here live at the U.S. Chamber of Commerce. We've got to hear from the people that are really making a difference in Medicaid health care people that are being awarded for the difference that they are making day in and day out. We're going to be back again in a couple of weeks. As you know, we have our regular
90 seconds
every other week, and we're going to be back, and we're going to have actually have a couple slots open throughout the summer for guest slots. If you're interested in being a part of the program, then you can go to MedicaidTalk.com. There's information form you can send back to us. It's been quite a morning. If you've been able to stick with us for both hours, you've probably learned more about Medicaid best practices than you ever thought possible. And certainly if you have comments or reactions,
60 seconds.
Why don't you go to our page. We like to see those, and we read every single one of them and appreciate them very well. As I said, our next show will be in 2 weeks on Tuesday on our regular date. We still have a few guest spots open through the summer, so if you're interested, go to MedicaidTalk.com and be a part of that. And don't forget to go to MedicaidTalk.com and register to receive a free best practice webinar from the Medicaid Health Plans of America's Center for Best Practice. It's a $150 value, and all you need to do is sign up for our blog, and we're going to have that drawing next month. This is your host, Richard Yaden. Today is Monday, April 30th, 2012. You've been listening to Medicaid Matters, brought to you by Managed Medicaid Services. Hope you have a great week, and we'll see you on the next show.